This is the first time we're officially launching outside of Geneva and specifically in Africa, in Kenya. We really feel we need to take the issues out to where they belong, not in fancy little sleepy places like Geneva, but where the issues actually become real and have a meaning. Why urban risk as a theme? You will find in the report a description of some startling trends that show increased growth of informal urban settlements, and with them an assortment of serious challenges, including the prevalence of communicable diseases, the effects of climate change, the pressing problem of youth violence, insufficient infrastructure that leads to unnecessary loss of life from fire hazards, traffic accidents, poor sanitation, just to name a few. Urban, from our point of view, is possibly the new rural. The majority of the world is crowding into cities. Some 1 billion of them now already live precariously in slums and shantytowns, and it's estimated that this population will grow to 1.5 billion and more over the next 10 years. The report shows that it is possible to overcome the challenges in urban settings and including in shanty towns. And maybe the two key messages we would like to give, and hopefully you will be able to take away from this, is number one, good governance counts, especially from local authorities and governments. All of us involved in trying to deal with challenges in urban settings must work with and involve the people affected. So residents of slums, for example, who are not victims but part of the solution. They need to be at the center of solutions. Our ask of all those involved in trying to tackle challenges in urban settings, and particularly again governments and local authorities, is really to work very closely with the people who matter, those living in urban settings, and particularly the 1 billion or so that live in shanty towns and slums, and find solutions with them, make the right choices with them and on their behalf.
To reduce disaster risk, one of the key messages that has been inherent to what you have heard so far, and you can read in this report, is really to focus on good development. It's all about improving the lives of the people. We want to urge you, us, and together here, since this is really everybody's business, to work together with community organizations, with technical institutions, academia, and with a very big and vibrant movement of the Red Cross and Red Crescent that can help influence the way that governance is actually being implemented. My call to you and to the organizers and the writers of the report is that now we do the best possible efforts together to use the recommendations of this report and turn them into our everyday advocacy and activity wherever we sit.
Welcome to Kibera, a home of over 1 million people. My name is Stephen Ologwara. I'm a member of Kibera News Network. We are bringing the real picture of Kibera to the whole world.
For many people in the Western world, diseases like cholera and TB are a thing of the past. But in Kibera, unfortunately, they are an everyday occurrence. Poor sanitation and contaminated water supplies contribute to the spread of the disease. Sewage runs openly in the streets, and children walking barefoot with rubbish underfoot. Kibera's narrow lane and cramped condition mean that disease can spread quickly, and residents cannot afford the proper medication. This man lives with his 4 children in a small house and contracted a serious case of TB.
ile shida niko nayo ugonjwa wa kifua. Hiyo ugonjwa vile inaanza kama malaria. Anza kusikia baridi, kosa hamu ya chakula, nitoa sina nguvu, mbea kwa sina tu kwa nyuma. Kama nitaenda hospitali. Sasa naendelea na kifua.
Na
hiyo TB ilipatikana kwa nini? Kwa mapafu.
kwa mapafu.
Tuishi mahali pazuri, nyumba safi, mahali kumwangaza.
Judith contracted cholera from contaminated water. She is still sick. She sits talking to us with her feet inches from raw sewage. 6 feet away, a water tap rises from the mud, with other pipes running through sewage.
Sasa hii bado sisikii mzuri, natoa hewa mbaya na mdomo, naanza kusikia kama malaria ndani ya tumbo. Mdomo ni kali sana, natema mate na kimesa hata dawa. Bado sisikii vizuri. Usaidizi ya dawa, matibabu. Maji, niambiwa nikunywe maji ile imechemshwa, na saa ingine naweza travel mahali hana maji nzuri, na kuanga na travel kama lodge, na unajua huko hakuna maji safi, huko ni maji ya chumvi. Sasa lazima nitumie maji ya duka, na saa ingine ukosefu narudia tu kunywa hiyo juu sina namna ya kununua hiyo maji tena.
Access to clean water and good medication is limited in Kibera. Until sanitation and medical care is improved, Kibera's health problem will be difficult to cure.
How do you see government fitting in as a bridge to ownership?
We did a survey of the various local authorities, and the results were shocking. There are some major municipalities that do not even have an ambulance. We are trying to come up with an innovative way of having a firefighting equipment mounted on a motorcycle. And same case with an ambulance, but mounted on a motorcycle. Because that is the only way you can be able to access these informal settlements. Because as far as the local authorities are concerned, they are not there, they don't exist. Because nobody applied for a planning approval. So as far as they are concerned, they don't exist. But what you have been telling them as a ministry is that, look, don't pretend that they don't exist. They are there. Yeah? So since they are there, let us give them services. Let's put roads there. Let's plan them. We can be able to put roads there, water lines, electricity lines. And even if you leave the other structures, that way at least, as we try to do the slum upgrading, then at least they have the basic services.
Coming to bridging the gap between planning at the academic level and at the ground level, the practice has been that of exclusion in the past, that from a legal eye, these areas are illegal. So giving them services is legalizing them. But the fact that they are illegal does not remove them from the face of the earth. So I think the change, the paradigm shift from exclusion to inclusion is very welcome at this point.
These people pay taxes, they vote, and more often than not, they contribute to the economy of this country.
At the same time, we need to link a lot with the people at the grassroots level. There is a lot of potential and a lot of homegrown solutions in those areas. Sometimes we pay lip service to development issues. Did you people know until today, the government of Kenya 40 years does not have an urban development policy, the government must walk the talk.
Leadership cannot be left to government alone. We have over the years focused a lot on economic development, and here in Africa we have made a lot of progress over the years in social development. The average African who lives in the rural areas would not live in a one room with his grown children. Unfortunately, this happens in our urban areas, and we have made it completely acceptable for people to live in human ways, in humane ways, in urban areas, in the slums.
What we see in urban settlements, and of course I think this report reflects it very well, that these informal settlements are a rising problem, is that communicable diseases are a big issue. The lack of health care, the lack of government investment can cause bigger problems than can be addressed immediately.
Solutions cannot be defined by people writing a report in Geneva or elsewhere, nor dare I say it in ministries. The solutions need to be found in dialogue with the people affected.
Security is paramount to development. And if there is good security, normally these problems of conflicts don't come in. So ours is also to try to sensitize the general public about the need to be the neighbor's keeper.
If we respect urban planning, if we embrace urban planning, we can do a lot of disaster risk reduction in our settlement.
As we said earlier, urban is the new rural. We know in the international community with our national partners, Kenya Red Cross, etc., what to do in rural settings over years of experience. We know it's better to give seeds than food. We don't have the same wisdom for urban settings, and we need to continue the discussion. I was asked earlier, should we try and stop urbanization by a journalist? And the answer to that was no, because urbanization actually has been a key factor of growth and development in many countries. It's inevitable. A trend does not mean destiny. There are positive things that can be done. And chiefly, what will make that happen is putting people first.